You're live. All right, good morning, everyone. It is Thursday, January 15th, House Government Operations, Military Affairs. And we have some guests with us to run through a report and have some discussion on Vermont Emergency Medical Services System Assessment Report. I have Patrick Malone on my testimony list. If you'd like to join us. How you doing, sir?
Morning. Thank you for the opportunity to be here. Do you need to know who I am?
Yes, for the record, please introduce yourself. Yes.
My name is Patrick Malone. I'm a member of the Vermont EMS Advisory Committee since 2011, and I'm a faculty emeritus at the University of Vermont, and also a licensed EMS provider and senior instructor.
So, this is, an ongoing conversation in the committee. So we just wanted to have you come in and kind of give us a rundown on the report, the findings, and just sort of a status update on this project as a whole.
Okay, I just, for complete transparency, I just found out about this at about 5:15 last evening.
Oh, cool.
Drew Hazelton, the chair of our committee, is had to be out of town.
Yep.
So he asked me to come down. So you might get some thank you notes from a class at UVM because I postponed their class so I could visit.
Thank you for joining us on such short.
Noted on the notes.
I'm sure I could answer any of your questions, but if you have any questions about details, I might have to work back to you.
It's fun.
All right.
Should I begin with the development of this report and
Please.
into it? I want to be efficient with your time.
Oh, we have more than enough time. We got about 45 minutes blocked out. So,
Oh,
so we have time for a conversation.
wonderful. Well, as a 40+ year member of the EMS community in Vermont, I really appreciate the legislature's help over the past, maybe over the past 10 years. Recognition, awareness have been increasing, and support has been increasing. And 40 years ago, that wasn't the way it was. So I really personally appreciate that. This report was, I'm not sure, mandated, requested by the legislature. And we spent the bulk of 2024 researching it and writing it. A couple of things contributed to its success. First of all, the participation of the members of the group. I think there's about 20 named members to the advisory council. And with the exception of maybe 3 organizations, there was really good participation throughout the project. We traditionally, our meeting schedule is monthly, but from about May, because of the work of this report, we start meeting 2 times a month. The meetings were held all around the state to give a chance for local participation. 3 of our meetings, or the 3 of our meetings, were full-day meetings where we had a facilitator to help us kind of get on the right track. In addition to that, we had a data assistant, administrative assistant to help collect and verify information that came to the committee after the data analysis report from Cambridge Consulting was submitted. She did just an unbelievable job. The data collection is really the biggest problem we faced. And Sue actually called service heads a lot to get information that either they did not provide or could not be obtained in other other places. There was a technical writer at the end to help us put this all together. And I have to brag a little bit, but students from two of my courses, EMS leadership and a course on trauma and trauma systems, and two independent study students helped us with a number of activities. For instance, last spring, we were trying to determine what states in our country had EMS plans, which is the next phase of this project. And they found that 19 of our 50 states had plans. And my current class is starting this week to update that to see if we missed any or if there's been any updates in plans. There's also
Quick question on that. Within those 19 states, are they larger population mass than we have? Is there a blend of states? You know,
it's all over the board. Two of the states, different ends of the population, that we are interested in using as a model are Maine and California. They both have plans that are they kind of make sense. They're easy to read, and we thought they were well developed. So those are the two examples I could give you. States that you think would have them, big states, Florida, Texas, I don't believe they do. New Hampshire has one. So it's kind of all over the board. But
understood. So you're focusing on the California and the Maine.
yeah, and the students this semester are going to be developing an outline to present to the committee to use for us, but using those two states as the model. Another student of all things from our GIS major, he's a GIS minor into mapping and such. He made several maps to make a lot of this data more understandable, which they're not in the report. I thought they were an addendum. I couldn't find it. But when I do, I'll get that to you. It might be in the form of a presentation. But just did great work to kind of visualize this and some other graphs. I have to compliment Will Moran and his team at the Office of the EMS and the Health Department. They were just really solid partners all in helping us with this. And finally, Drew Hazelton just did a superb job as the chair of this group, providing leadership and drive. The work that we started came on the heels of getting an analysis of the system by an out-of-state vendor called Cambridge Consulting. They provided a report in May of 25, which the goal of which was to provide a clear understanding of how the system is structured, governed, and operated, and to identify areas of inconsistency, inefficiency, and dysfunction. And their focus was on an analysis and the findings. They did not make recommendations. The major findings include that there's a lack of EMS coverage standards. The system relies heavily on volunteers, and especially in the more rural areas. And the entire system is strained by call increase from year to year and financial issues. They believe that in terms of structure and governance, there were too many EMS districts. The state is divided into 13 EMS districts. Everybody always asks why there's not 14, and it doesn't go quite by county. It goes by catchment areas of the various hospitals. So one of our districts is kind of based in New Hampshire with the amount of the number of patients that go from the field to Dartmouth Hitchcock. And they thought that was it's varied how effective and efficient these different districts are, with some districts doing a minimal amount of work. As a matter of fact, we have two EMS districts out of 13 who have not, each district gets a representative and an alternate to the committee. And two of the 13 districts have not named a representative. So they're marginal, if any, participation.
One moment, I got a hand here.
I have a
first.
Thank you. I have a quick question. The districts are named by number. Do
Correct.
they correspond to anywhere on the map? Because I'm looking at the one map that is in the report.
So if you start with northwestern Vermont, that is EMS District 1.
Okay.
EMS District 2 is around Newport.
Okay.
EMS District 3 would be Chittenden County, a little bit of Addison County, and most of the islands
Goes like this.
Yeah.
Down the map.
on the map, with District 12 being Bennington and District 13 being Brattleboro.
Perfect. Thank you.
We are in EMS District 6 at the moment.
Okay, good to know. Thank you.
They also, they found that the EMS office was understaffed. They believe that there's problems with data warehouse information and collection. That in terms of EMS operations and for performance, they believe that there are too many small agencies, which in addition to that, unequal call distribution and long responses. And just as an aside, I'm not sure those particular issues can be addressed. The urban centers of each, or the more populated centers of each district, each county, will have a higher call volume than our communities that have 1,000 people. So in terms of financial status,
I got another hand over here.
yes.
Okay, this might be a naive or ignorant question, but I'm wondering, can you explain to me why the call responders or those centers need to be geographically near where people are making those calls? Does that make sense?
The call center,
Or you're talking about the dispatch, right? Like the people who, are you talking about the people? who
dispatch
answer?
is a whole different,
Oh, okay. You're talking about the actual people driving the things and where they're coming from.
yes.
Okay, all right.
That's the next hearing.
Oh, okay.
And, you know,
Call or something. I just need a little clarification. Thank you.
I was here in the mid-90s when the
Yeah,
911 system was established.
yeah,
And one of the options for Vermont was to have
one 911 call center for the whole state. And the model that was working, the first state in the country to have E911 was Idaho. And Idaho had one call taking center, and Vermont decided to regionalize it.
okay.
Vermont became the second state with E911 in the country. So the services are, I don't know how to explain it, but I would bet that all of our 251 communities, almost all of them probably have some level of fire department, right? That's not true for emergency medical services. There are 90 first responder services, and there are 65 or 68 ambulance services.
Representative Engel?
Thank you for the clarification for the committee. And a first responder could be just one individual in their private car going to someone's home to be there until an ambulance gets there and provide very basic first aid. Is that correct?
That is correct. I don't have it at the top of my head, but I believe for an organization to have a first responder license, they have to have a minimum number of personnel. That doesn't mean you're ever going to get more than one. It is a person with equipment in their own vehicle. Typically, there are a couple of organizations that have a response vehicle. that gets there and provides emergency care until the ambulance comes. And not all rural communities have that. I live in Fairfield, in EMS District 1 in Franklin County. And in Fairfield, our ambulance coverage comes from Amcare Ambulance in St. Albans, and there's no first response.
Yeah,
So at my house, I could have 45 minutes before the ambulance gets there.
right. So I live in Berkshire. We had a first responder, but she's since moved away.
One.
Yes, one. And so yes, similar wait time for an ambulance.
It's the nature of rural.
Yeah.
Really.
But I just want to make sure everybody knew that those 90 first responders are very scattered throughout the state, and many geographically large areas truly have no first responder and no ambulance in their town.
Right. And if you want to see the direct effect of that, in the report, oh, I forgot to mention, the list of committee representatives is on page 16 of the report. So you could figure out who represents the community or the district where you live. There is on page 9, there is a couple of charts on first response and ambulance response times. And just to be clear with that, dispatch to en route means that the call comes into 911, 911 calls the appropriate dispatch center, and they send the alert out to the appropriate agency. And from when they receive that dispatch to when they arrive at the scene of the emergency is the second time. So for first responders, you could see EMS District 5, the average response dispatch to arrival time is almost 22 minutes. District 5 is the Northeast Kingdom.
I think it's important to, sorry to jump in, but important to name the districts so that folks listening, if you are in the Northeast Kingdom and you know of a potential solution to this, to have someone appointed to this committee where there is no representative, that would be really helpful to reach out to Drew Hazelton or any others that are on this report. Email addresses are at the end.
The statute states that each of the 13 districts have a representative. And unfortunately, EMS District 5 has not appointed a representative.
Right.
And I don't mean to finger point, but the Northeast Kingdom, just by the nature of it being the Northeast Kingdom, is a very challenging place to provide emergency services. And I think it's not that they don't have a representative because they don't want to participate.
Right.
I think, by the time, you join emergency medical services, by the time you get training, by the time you do ongoing training, all the other kind of logistical and operational things, and in an area like that's mainly volunteer, there's no time left to do something like, contribute your time for the functions, to help with the functions of the district. So.
So I'm in Dorset, which is, we are serviced by the North Shire Rescue.
That would be EMS District 12.
Right, so in reading this, these times are probably average time because it certainly would take longer than 2 minutes or 9 minutes to arrive from North Shire to some of its surrounding towns that it covers.
Yeah, that's it's district wide,
Right,
so you think about, look at, EMS District 3, which is Chittenden County. It's 2 minutes to dispatch and they get there within 8 minutes.
Right.
And that includes
traffic.
the Burlington Fire Department that goes a block away, and it includes Essex Rescue that has to go to the bottom of Mount Mansfield on some dirt road in Underhill. So that's what causes a lot of
Can I guess one more? And then as far as the mapping goes, I think it would be great if there was an overlay of just the districts, so people could identify like another map or color coding of the counties or the represented, so you can see which district one might be purple district or just an overlay of another map where you can see where the districts were.
We will get the committee a district map, which is on the Department of Health EMS website. I believe on page 7 is a link for an interactive map. And I didn't have an opportunity to look at that closely last night, but I believe there'll be a map of the districts embedded in there. There should be.
Find it.
You can't find it? Okay, we'll make sure we get you.
Um, If you don't mind, I'm still following up and you're next. Thank you. So back to the districts that are not named, that have no representative. District 11 is where?
District 11 is Springfield,
Okay,
Northern Wyndham and Southern Windsor, if my geography is correct.
okay, thank you. I appreciate that. And
Springfield would be their hospital.
I guess my concern is, does it have to be an EMT or someone who works for an ambulance system to be on this committee, or could this committee be their area be represented on this committee by a layperson?
My understanding is that the district has the representative, and I don't believe there's any guidance on who to select.
Okay.
I will tell you that of the 11 districts that participate regularly, let me see. 1, 2, 3, 4, 5, 6, 7, 8. 8 of the people are the chair of the district, eight of the 13. At least 8 of the 13.
Representative Stone?
I'm a healthcare worker when I'm outside of this building, and I'm just wondering, do you have any recruitment strategies that are using to tell healthcare workers who we have in these big hospitals like Dartmouth, Hitchcock, University of Vermont Medical Center, or even some of like the students who are getting trained to be healthcare practitioners, that there are needs in places like Rep Pango's community where the one person they had moved? I'm just wondering if you have any partnerships because I haven't heard of anything in the medical center. Otherwise, I would have.
In Burlington?
Or anywhere, any of these places, because not everyone in the medical center works in Burlington. A lot of people commute to Addison County, to Franklin County, et cetera. So I'm just wondering if y'all are doing any education outreach to let people know that there's a need. Because I haven't heard of anything. If I had, I would probably volunteer.
There have been efforts, statewide efforts, district efforts, and local efforts targeting the recruitment of people into the system. That extends to, there's been some work with workforce development. There's been some work with, I don't know the official name of this, but the tech ed centers aligned with high schools. Several of them have EMT training programs to hopefully get young folks involved in this. At the University of Vermont, we can't teach enough EMT courses. We have an emergency medical service minor. We have people who are in that minor. Probably half of them are some pre-medical professions, PA, nurse practitioner, healthcare provider. About 25% of them want to get into emergency services as a profession, opportunities of which are increasing in Vermont. And the other 25% are associated with things having to do with outdoor education, recreation. 8 of the 40 game wardens in the state were trained in our programs, for instance. But our students, there are organizations that look to our training programs to recruit students, and they serve as clinical sites for us. So one example of that is Dave Doerson, who was the director of Barrytown EMS. And he understands that if he takes a student and by the time they're ready to work in the field, students from our program are typically juniors, right? So they'll be in Vermont for 2 years. And Dave hires them knowing he'll only get 2 years out of them, and also knowing that we're going to have somebody trained to take their place. So we send our students this semester that they're either employed or volunteer in EMS District 1 with MCARE ambulance, and EMS District 4 with Northern Vermont EMS and Hardwick Rescue, EMS District 6 with Barrytown EMS and Waterbury EMS, and an EMS District 7 with Middlebury Regional EMS. So we're actively sending those students out, plus there's students who are Vermonters that get trained and go back to their community, and they all know there's a shortage, so.
I have a clarifying question.
Please.
I'm also talking about like first responders, like, for example, like not now because I'm here, but I worked an 8-hour day at the hospital. I may not be able to be like, working with an EMS team, but I could be a first responder or put my name on the list. So I was wondering if there were education efforts around that.
There are. To be a first responder, the individual can't just live in Fairfield or Berkshire and be an EMT and grab a kit and go. They have to be, because of the system, they have to be a member of a licensed organization. And to be a legal response to meet state regulations, they have to have an EMS license. So I don't know what
I have an EMS license.
what
Okay, that helps.
level you have.
I'm an occupational therapist certified license, so advanced level.
So you would have to be at the minimum of a Vermont first responder, a VIFR, which is you have to have some kind of training, which I would bet from occupational therapy you have. And then there's a 16-hour course for some essential EMS functions, which include, what the heck do you do until the ambulance comes, like from an operational standpoint. So that'd be an easy entry point. I don't think occupational therapists are specifically listed, but if you are a nurse, if you are a physician assistant or a physician, there are streamlined paths, or a nurse, I think nurse practitioner, have streamlined training programs to earn that certification to be part of the response system.
That's good to know. So I'm just thinking working smarter, not harder. We don't have like a huge population here in Vermont, but I'm also thinking for continuing education credits, which I'm currently doing right now.
Mhm.
I mean, we probably could get those too if you're a nurse, if you're someone, just again, using the population we
Don't
have.
mind me asking, where's your home?
Burlington.
Burlington.
But a lot of people I work with at the hospital, they drive home, like I said, to other places. To
Right.
Franklin, to Addison County,
Right.
more rural areas.
Mhm.
I'm just trying to figure out how to kill two birds, one stone here.
Representative Hango?
I really like this line of thought. This is really creative and it might be somewhere that hasn't been explored, because Rep. Stone brings up a really good point that many folks who work at UVM Medical Center go home at night and on the weekends to far northern Franklin County, my district. And our medical professionals already, and what I'm hearing is they could take a 16-hour course or even a shortened course if they already have some of the qualifications and become a first responder so they can get to their neighbor's house before an ambulance gets there and stabilize the patient, or just be the medical presence there to be a calming presence for the family or whoever is living in that dwelling. Is that correct?
The minimum amount of training to get a license in Vermont is 16 hours.
Yeah, that's
Yeah.
easy.
From my 40 years of educational experience, 20 years ago, maybe up till before COVID, we would get, in our programs, we would get healthcare practitioners who were retiring from their primary occupation. And now they have more time, they're living in their community, and they become an EMT,
Mhm.
to either work with the local ambulance service or the local first response service. Because of how COVID has changed everything, I don't personally see that as much. The healthcare individuals that are in healthcare professions have nothing left
Mhm.
to do stuff like this, to be my personal view of it. We always used to get, I think the oldest person I ever had in the class was pushing 80 that wanted to be an EMT in a rural community. So
These first responders do not have to be EMTs, is that correct? There's a certification program for the person with their personal car and some equipment to go to a home and just be there until the ambulance comes.
there is, you have to be a licensed first responder.
Right, but not an EMT.
Correct.
Okay, great, because I'm thinking, like, someone who might have young children who have childcare and could be on call for a certain number of hours, but they are not working currently in the hospital because they don't have that much time to devote to that, or they want to be home with their family. Somebody like that who might live in Franklin or Addison County, for instance. Just trying to be creative here.
That is a fine idea. And, in my experience and professional opinion, there's actually a term for it. It's called the paramedic paradox. Okay, so the further you are out into a rural area, the further from the hospital you are, the more you need additional training, right? So South Burlington doesn't need a paramedic as much as Averill needs a paramedic, right? And you can't make paramedics everywhere, because if you put a paramedic in Averill and they sit there with their kid, they're not going to have any calls because there's no people there, a few people there, right? So I think encouraging the development of people at the EMT level would be my idea if you said, and there's still an EMT class might be 130 to 140 hours, but somebody who has had training in anatomy and physiology and assessment and disease transmission and all those things are part of an EMT curriculum, all of a sudden that 140 hours is now like 70 hours. And 70 hours is what it takes to make a licensed emergency medical responder, somebody who has no training at all, if you want to become a responder. So the investment of the time for a healthcare professional to be an EMT would give you a much larger scope of practice and a much more robust response to emergencies, especially the critical emergencies.
Helps.
Oh, you're just- yeah.
No, it helps with continuing education. I'm having to do 36 hours right now that I have to submit to the Secretary of State and the National Board of Certification for Occupational Therapists. So that would also help. That would count towards that I'm already having to do. Those significant hours.
Any other questions for this portion? All right, cool. Let's keep rolling.
I kind of went a little bit off track, but
We have a tendency of doing that.
I'm the perfect person to be here.
the Vermont EMS system is at a critical juncture, is what the summary of the Cambridge Consulting report says. Okay, so now our system assessment, we divided different areas up and had subcommittees work on these. I myself led the education and training committee. So if you had questions about that, I could answer those very easily because I was there. I was here for every step of the way. But one of the first things that we did on page 2 is a definition of emergency medical services. And I think many people may have skipped right over that thinking they know what emergency medical services are. But in those 19 state EMS plans, not one had a definition of EMS, not one. And the regular definition of EMS leads you to believe that somebody's got a boo-boo and the ambulance is going to come and put a Band-Aid on it, right? It's all about emergency response. And we are at a point, especially if you consider all the healthcare reform issues. The Oliver Wyman report had many of the recommendations impact EMS. If a hospital, a rural hospital is going to lose services, you have to have some way to get the patient from the rural hospital to the tertiary care center, right? So the role of EMS is changing as healthcare changes. There's going to be community paramedicine, where a paramedic is not just sitting in the station waiting for an event to happen, but if they've got a member in their an individual who lives in their service area who has a chronic disease, for instance, somebody with chronic obstructive pulmonary disease or diabetes, they may be going there a couple times a week to make sure that person doesn't need assistance with their medications, with blood glucose monitoring, et cetera. So our definition, we try to make it broad enough to position us to be ready to take on these additional challenges as healthcare reform happens.
Very quickly, the non-emergent practice of medicine in the out-of-hospital environment is not currently reimbursable to an EMS system. Is that correct? To an ambulance system?
There's two answers to that. One, non-emergent would imply a part of non-emergent would be the ambulance call where the EMS unit arrives and either the person doesn't need much assistance or minimal assistance, or maybe they don't want to go to the hospital. So the EMT or the paramedic, the service can give you care. Come splint your ankle, help you get in your car so your family can drive you to the hospital, saving you the cost of EMS, plus allowing that EMS unit to be available sooner. Okay. There's no reimbursement for that. The other thing is the expansion of the scope of practice with EMS units. And Rescue Inc. down in Brattleboro is doing this. And I don't know all the exact details. Drew Hazelton would be the one to answer your questions. But basically, they're treating, they've got protocols down there where certain chronic diseases the people are in this program. And the EMS folks, in conjunction with the physicians who are caring that patient, for that patient, have a set of protocols to minimize the healthcare costs of this by keeping the patient out of the emergency department and therefore saving overnights. And that is reimbursed. I believe it's funded by the hospital and not insurance funds.
So that's the community paramedicine.
That's part of it, yeah.
That you're talking about. Okay, great. Thank you.
How would you like me to proceed through this report? Section by section, you want to ask questions? How could I help?
Yeah, we get that. Yeah, let's do section by section. We'll stop at the end of the section for a little Q&A on that instead of holding it for the end. That's it.
Okay. We get to overall system performance, and the system faces significant challenges that compromise effectiveness and sustainability. The service levels, response times, and staffing vary significantly by town. Interfacility transports, which are transports primarily between hospitals and healthcare centers are not consistently reliable. There's often delays. There's only maybe six or seven agencies do the bulk of those transportations. There's different revenue mixes to support EMS in various areas, and there's gaps in the funding. There's funding gaps in training, education, data collection, and medical direction. EMS is considered to be physician extenders, so all EMS is delivered what's called medical direction. And a medical director would do things like help establish protocols, work with quality assurance and things like that. MIH is the other part of community paramedicine that I described, mobile integrated health. Okay, so that's overall system performance. That goes into governance and system structure. I already mentioned about the EMS districts, but in terms of the delivery of EMS, there's four models that are the primary ways that EMS gets delivered in Vermont. One are regional EMS systems, and a regional EMS system is a service is located in one town, one city, and then contracts with surrounding communities to provide EMS. So in Franklin County, EMS District 1, Amcare Ambulance is based in St. Albans and goes to probably maybe half of the towns, a third of the towns in Franklin County. They don't, a large geographic area like Franklin County, Amcare Ambulance Service actually has a substation in Sheldon. So it's closer to get to the farther reaches of it. There are formal regional systems, regional ambulance service in Rutland. EMS District 10 is Rutland County. And I think there are only 2 or 3 EMS services in that large county. But they have many towns that they cover. Career fire department based EMS, not every municipal career fire department does EMS, most do. And what occurs there is that the personnel in the fire department are also trained as EMTs or up to paramedic, and they have an ambulance that they do their own first response and ambulance service. There are a few municipalities in Vermont that fund their own services. Shelburne Rescue does that. I think Chester does that. So it's a town service like the rec department or the street department or anything else. And then there's local service providers, and most of those are some level of not-for-profit organization that a growing number of them have some level of professional leadership. They pay a director to take care of admin stuff and to at least have somebody on call Monday through Friday and manage the part-time or career staffs. Questions about that? There is a map, and that interactive map I had referred to. If you go to that site, you could click on your area and get all the details of how EMS is delivered. That's that hyperlink.
Yeah, I appreciate that dashboard.
Going down to data sources and limitations. I don't know if nightmare is the right word. I think it is, but every data problem you can imagine, we faced while we were trying to get an objective view of our system. I could specifically speak, there's data gaps in clinical data collection. There's data gaps in operational data collection. There was hardly any data source available to get financial information. I spent a lot of time trying to learn the details of the EMS education system. And my method of data collection was to call licensed educators and ask them how they did stuff and what it cost them to do it. So it's something that if we really want to improve the system, we have to improve data collection and management.
Do you know why it's so nightmarish?
There are lots of reasons, going from agencies that think it's not important, agencies that don't have the capabilities. There are organizations and agencies that worked with us that did not want to share information or easily share information.
It's my town.
Yeah, and some of the information was thought to be proprietary. So I tried, an example of this is I tried to find out how much it costs to educate an EMT. 140-hour course, set curriculum. And I have no answer for you. I have no clue. Right? There's an EMS organization that uses, they will recruit people without, and when they have enough for an EMT course, it becomes the job of their full-time personnel to teach that course when they're working. So the recruits pay nothing because it's part of the recruitment process. And the agency doesn't think it costs anything because the personnel costs, which would be the bulk of costs, are absorbed by the operational expense of the department. So others, they don't want to know that, they're getting $1,000 and it's only costing them $100 to train a student. There's different things like that. But even in terms of sharing information, we had challenges with entities trying to get information like data on interfacility transports. Right? There's just challenges all along the way. So some of our data analysis was best guess. The state, in terms of statewide EMS data, as far as we know, there's about 100,000 911 calls per year. And the year we worked with was 2024, the year with the most complete data. And that's a 6% increase over 2023. About a third of those did not result in transport. Back to what we were talking about before. Now, that doesn't mean in a third of the calls, an EMS provider did an assessment and management. Sometimes there's a 911 call where they get to a place and there's no call, right? Somebody in town sees somebody trip and fall on the sidewalk. They call 911 and the ambulance comes and the person's sitting on a bench saying, "I'm fine, I just slipped." So there's no event or a fender bender that cars drove away, something like that. So there are about 28,000 interfacility transports, which were about an 8% increase on that call volume. We get on to the cost of the system, and our best guess is that the Vermont EMS system, the total cost is about $98 billion per year. Out of that, 53 million is insurance reimbursement, which is about 54% of the cost. About 43 million comes from local tax support. The value of volunteer labor, our best guess, is just under $10 million a year. A little over $1 million a year happens with fundraising. Fundraising is all over the board, from services that will more of the nonprofit type organizations. If they respond to an event, they might send an appeal for a donation. I think there's still some services that might have other fundraising type events. And then the provider taxes ring in $1.4 million. And the provider tax is a tax that the state collects in order to get a larger Medicare, Medicaid reimbursement
And they collect that from home, sorry.
from the service. Yeah. We looked at the average cost of calls, and the most expensive cost per call are with those career fire-based systems at $1,168. And to note, those costs are higher because those organizations support their fire-based work as well as their EMS work. Next comes municipal services, which are about $800 a call. Regional services, it drops down to $670 per call. And then local services, it's about $729 per call. And then their percentage of compensated staff is listed there. So ambulance reimbursement from Medicare and Medicaid is inadequate, and towns that support their EMS units, that goes back to the property taxes, burden on the property taxes. One thing we learned about the financial reporting of the EMS agencies is that it was really a challenge to get financial information. So one of the things that we were thinking about, Vermont lacks a mandatory financial reporting system for EMS organizations. So that might be something to think about in the future. Volunteers availability is decreasing, and I'm sure all of you know that all aspects of volunteering, not just things like EMS, are decreasing as time goes on. Okay. System structure and service delivery. I mentioned that there are first responder services. I'm corrected, 65 ambulance services, and then 2 out-of-state services provide care here. There's a couple of unique delivery models. There's a ski area that has a part-time service, and I think by part-time, it means that when the snow melts, the service isn't in operation. We have 2 college services at St. Michael's College, which really acts more like a regional EMS service, a fairly high. They're probably in the top 10 busiest services in the state. And then the University of Vermont, who provides for campus back up to the cities of Burlington and South Burlington. Okay, we talked a little bit about.
One more, I got a hand from.
Yes.
I'm curious about the history of that St. Michael's arrangement. How long have they had their own fire department?
There was St. Michael's Fire and Rescue was started in 1969 with the death of a student and a lack of an ambulance to come help them. So a guy named Don Sutton said, we can't have this. And he started the student-run volunteer organization, which that was before the EMS system started, which was formally started around 1974. And at 1974, St. Michael's Rescue probably had 2,000, 1,800 calls a year, and they covered Winooski, Williston, St. George, and Heinsberg. And now as the system developed, and a lot of those communities have their own resources, they cover their campus and Winooski as primary response area, and then they are a backup for Colchester and Essex.
Mhm.
UVM's student-run service started in 1974.
And Winooski has no service of their own? Or
They do not. They have relied on St. Michael's Rescue since 1969. Yeah. Are you from Winooski?
No, I'm from Brookfield, but I just noticed that last time I was up there, and I thought it was interesting. So they serve all of Colchester.
No, they just serve Winooski. Colchester is an example of a municipality. It's got a career fire department starting and a municipal-based EMS service, which is not, it's under the fire department instead of dual role cross trained like Williston. They're separate, but in-town government.
I'll be conscious of the time. We're gonna shift gears in a little bit here, so.
Interfacility transport, that's, we mentioned that earlier. I'm not sure there's anything to say about that, except in our view, my professional view, that area of EMS is going to be growing substantially with healthcare reform. Education and training, we did a lot of work on that. You probably would have a lot of questions, and I would be happy to come back and dedicate more time to that.
Yeah, I think that's something that we'll flag for follow-up after, doing this run through on the report. I think seems to be a worthy conversation to continue having based on that Q&A earlier. Yeah.
There's a glossary in the back with some definitions that might be helpful. And the committee members and the alternates and their contact information. And I don't have to leave until 5 minutes of 11 to get to class. So if you want me to keep going, I don't know if there's somebody else scheduled or. Oh, Dan Bates's here.
How you doing?
Anybody might want to listen to the discussion for a few minutes that we're having with the next one.
Yeah, I want to be respectful of time here, so why don't we shift gears over to this? And then if there's, have you interject in the gallery, we'll do that. We'll just kind of keep it a little like structurally abstract. That's that.
You'd like me to stick around for a while?
Yeah. If you have the
If you want
time.
to.
Yeah.
We're doing it for those students.
And that's the second class.
If you gotta, but we can always follow up on this stuff more later if you.
I'd be happy to come back anytime.
Let's do it.
You always meet on Thursdays?
We meet Tuesday through Friday.
I don't know if I could do this, but Wednesdays are the best day. I don't have class on Wednesdays.
Tell me what the best day is for
Wednesdays or Fridays are great.
Yeah.
Wednesdays and Fridays are best.
No, that's wonderful. Yeah, no, we want to be as accommodating as possible to your schedule. So,
And we don't typically ask people last minute to come and testify, so we appreciate that you were able to do that.
yes,
I'm glad I got to do it.
yes. Okay, wonderful. Well, thank you so much for your time, and we will continue this for sure. All right, shifting gears. How are you doing, Deputy Commissioner? It's been a little while.
Good, thank you.
Yeah.
Chair, how are you? Are you ready for me?
Please, come on up. Yeah, we're just gonna
With
keep
your
this all
permission,
going.
Barb, you'll see Barb Neal is online as well. She's the co-chair of the task force. We thought we'd double team this.
That sounds
to make
great.
your time most economical.
I love government efficiency.
Especially given that.
One of our mantras.
Exactly the same thing I am. Good morning, everyone. Thank you. And for the record, my name is Dan Batesy. I am the Deputy Commissioner of Public Safety. And with us today also is Barb Neal. I'll let her introduce herself in a moment. And then also Paul White from the task force. He's been a very active participant as well.
Wonderful. Hello, folks. How are you?
Doing well, thank you. As soon as I get the mute button under control.
Yeah, it seems to be under control. You nailed it. Yeah.
Thank you.
Mr. Chair, Barb has a PowerPoint she's going to run through as well. And Barb, I can't see you, so I'm going to kind of just let you start.
Yeah, no, that's great. And could you give her access for share screen? And also, if you wouldn't mind emailing that to us so we can put it on our post it on our site for testimony today in case anybody wants to look at it later on.
Sure, I can absolutely do that. Given my skills for multitasking, probably I should do that after I'm done presenting.
No, after
it.
committee is totally fine. That's not a now
Okay.
thing. Yeah.
Okay, let's see. Let me pull this up here and see. Are you seeing the beginnings of a PowerPoint? Okay, let me get to the beginning here. Good morning, everybody. For the record, I'm Barb Neal. I am co-chair of the Public Safety Communications Task Force and also executive director of the Enhanced 911 Board. Dan's already introduced himself, and Paul White, our vice chair, is here with us as well. We're here today to talk about the Public Safety Communications Task Force recommendation summary that was sent to you on December 1st. And at the outset here, I should let you know that the task force is continuing to work on a more detailed report about these recommendations that will maybe fill in some more information for you about where it is we are with our work. That should be over to you within the next, I think it's 10 days to 2 weeks. So something to look forward to, so to speak.
Thank you.
So brief history and kind of the background of where we are. The Public Safety Communications Task Force was created by Act 78 in 2023 and charged with the planning and implementation of a reliable, secure, and interoperable statewide public safety communication system. The system needs to be equitably and sustainably financed, accessible to all, and it needs to enhance and build upon previous efforts and initiatives. Here is an overview of the task force membership. We're actually made up of 7 members. The co-chairs of the task force were defined in the legislation as the Commissioner of Public Safety or her designee, and the Executive Director of the Enhanced 911 Board. So Commissioner Morrison had the role of co-chair until I think it was maybe the middle of last year or so, when she designated or delegated rather that role to Deputy Commissioner Dan Batesy. And at one of our earliest meetings, the task force elected Paul White as the task force vice chair. Paul had previously served, some of you may remember this, as the chair of the Regional Dispatch Working Group. And he's also served as chair of the Barrytown Select Board and is a retired captain with the Vermont State Police. Jim Mack is the representative, well, he is from the Shelburne Police Department, and he is the representative from a public safety answering point, or PSAP, that is overseen by a municipal police department. The Vermont League of Cities and Towns is represented by Mayor Mike Dunges from the city of Rutland. Ron Kumitz, chief of the Alburg Fire Department, is the representative from the Vermont State Firefighters Association. And the EMS community is represented by Michael Wright, Chief Executive Officer of Calex Ambulance. So the task force is supported, has been supported since our inception, really, or soon thereafter, by a team of contracted partners. One of those partners is a company called Televate, who serves as the project management team for the task force and really serves as trusted advisors as we navigate through all the different aspects of the work required by Act 78. And then we also hired a team of subject matter experts from Mission Critical Partners, and I'll tell you more about the work of both of those in just a bit. So certainly we appreciate all the work of the task force members and those contracted partners, all the work they've done and continue to do to advance the work of the task force. Here's a program overview, kind of how we have applied the requirements of Act 78 to our work. The task force has held over 70 regular meetings over the past 2.5 years, all of them open to the public, and with the help of our contracted partners, engaged in multiple stakeholder meetings around the state to gather and analyze information about the existing public safety dispatch landscape, including LMR, mobile data, and other critical systems. Much of the early outreach to stakeholders was conducted by Mission Critical Partners. who also facilitated those various stakeholder meetings around the state. And Mission Critical was tasked with producing 2 reports for the task force. One was the System Inventory and Assessment Report, and the second was the System Planning Options and Recommendations Report. So the inventory and assessment really answered many of the requirements for information gathering that were laid out in Act 78. And then the System Planning Report was designed to present options to the task force of potential paths forward in various areas related to public safety communications. So the information in both of those reports serves as a foundation for the task force discussions that resulted in the recommendations that you will see today. Both of these reports are available on the task force webpage, and I can certainly send them over to you if that's easier, so you can have them all in one spot. So as stated in Act 78, the primary goal of the task force is to advance this reliable, secure, and interoperable statewide public safety communication system. These preliminary recommendations should be viewed as first steps in what will be a long path forward to improving and supporting the public safety communications system in Vermont. The recommendations utilize resources that you, the legislature, have already provided to us via the general fund, and are what the task force sees as viable options in this complex, multifaceted work. We believe, the task force believes, that these recommendations or implementation of them will lay a sound foundation for the future expansion and enhancements within the system itself. I mentioned that we are developing this more detailed report that will be coming along soon, and we're looking forward to continued feedback from you, of course, and really from all of our stakeholders when those additional details are released in the next week or so. And I do want to mention here that the 911 board itself has not reviewed the entirety of these recommendations. So when I'm talking to you today, I'm speaking as the co-chair of the task force, but not necessarily conveying the 911 board's full position on this. So I just wanted to make that clarification.
Barb, before
Okay.
you go on, can I just add one thing?
Yes, please.
Yes.
Just to give you context, Barb is being very professional here. I've never been accused of being subtle, so I'll just say it this way. To accomplish the goals that have been laid out in this act are incredibly challenging. This is a Middle East peace level challenge of getting everyone to agree. It's challenging politically, it's challenging economically, it's challenging technologically. And what we're presenting to you today, as Barb pointed out, really are foundational first steps. There is no panacea, there's no magic bullet or pill that we can offer that is just going to turn this around and fix all these challenges. What we've tried to do is be very responsible, thinking about resources that are available to us immediately, and build a foundation that we can build upon. So I hope you'll take these recommendations in that spirit. Thanks, Barb.
Yes, excellent. Thank you, Dan. So as the recommendations were being developed, the task force identified multiple strategic objectives from Act 78, and we're presenting these to you kind of aligned with those objectives, so that you can see kind of what our thinking was on all of these different aspects of the system. So strategic objective number 1 was governance and establishing a governance system. The task force recommends establishment of a governance board that operates as an independent entity, has decision-making authority and the authority to approve minimum technical and operational standards and enter into contracts and agreements, and that promotes service improvement and organic consolidation based on common performance benchmarks. The governance board would have a number of responsibilities related to the other strategic objectives here, including reliability, excuse me, which brings you to the second entry on this table. The governance board would then establish a minimum set of policies, procedures, and protocols to be followed by all dispatch centers serving Vermont. There'd be the development of standardized quality assurance, quality control process and materials. The governance board would develop a list of approved initial and ongoing training programs, followed by a statewide certification program for all emergency communications personnel. The board would develop templates to standardize job classifications and descriptions and promote dispatcher reclassification. Ongoing dispatcher training and leadership workshops would be developed. The board would support or work to support a hybrid staffing solution that could be used across centers for resource backfill and staffing emergencies. And then would also develop solutions and best practices to facilitate statewide public safety system, communication system, rather technical and operational failover. So those all would be the tasks associated with reliability in a statewide system. Regarding the strategic objective of interoperability, the recommendation is to secure a new computer-aided dispatch system with multidisciplinary functionality. So addressing the needs of not only police, but also fire and EMS. And then building towards or ensuring CAD-to-CAD interoperability exists, and that there are interfaces to location data mapping and any records management systems that might be in place. Also, the recommendation is to expand the use of RapidSOS and the state GIS resources for all dispatch centers. And since I have a level of knowledge on this particular thing, I'll expand a little bit. RapidSOS is the mapping solution that is used in the 911 system. The 911 board has actually secured some licenses to allow dispatch centers access to the same mapping solution. The task force is looking, and I'll get to this a little bit more detail in a minute, is looking to provide some funding to provide additional licenses for the RapidSOS solution in dispatch centers. It'll allow for a more seamless flow of information between the 911 system and the dispatch centers around the state. Another recommendation related to interoperability is to update the LMR, the Land Mobile Radio Infrastructure. And I'm sorry, I lost my place here. And I'm going on to the next slide here. Right, okay, so that was it for interoperability. Sustainability objective would be met through the governance board and its operations being covered by remaining Act 78 funding for 3 years, at which time dispatch fee assessments would continue to provide funding for that governance board. In the objective of achieving equity, the task force recommends that a fee formula be established that incorporates towns that are not currently paying for dispatch services. There's a lot that could go into the development of this formula that would need to be discussed by the governance board and finalized. But the task force certainly sees the inequity in some agencies or towns paying for dispatch services and others not. And then security is another strategic objective. The recommendation is to establish statewide cybersecurity governance, risk, and compliance framework and perform periodic assessments and direction related to cybersecurity. And accessibility. So all dispatch centers would be, I want to say it required, it would depend, anyway, all dispatch centers, the goal would be that all dispatch centers provide service subject to specific policy and technology benchmarks as defined by the governance board. That collected dispatch fees would support technology and shared resources for all dispatch centers, and that the governance board would work with the broadband board and the public service department to provide coverage gap data to cellular providers. And I'm going to pause here for a second to see if Dan or Paul has anything to add on, because this was a pretty high level overview of the recommendations. Dan, do you have anything more?
Yeah, I'll just add one element. One of the biggest challenges that we identified in the comprehensive review is the fractured nature of our system. And we have dispatch centers that are operating little or no supervision with different levels of quality. And the establishment of a centralized governance process is the first step in bringing that fractured system together. Now, there's a lot of different ways that can be done, but the most important element of that is to establish standards and review and to define essentially what dispatch is in the state of Vermont. I think that will lead to a lot of the other elements that we're about to discuss. If we have that capability and can say, this is what it means to be a dispatch center, this is what it means to be a dispatcher, this is the qualifications, we can sort out a lot of the other issues that are going on further on down the line. So to me, that's the foundation that's most important.
Great, thank you. Paul, anything to add here?
I don't have anything to add right now. Thank you, Barbara.
Okay, all right. Okay, then I'll carry on and we'll get into a little bit of the, again, high-level funding discussion. So what we're looking at is the resources that have already been provided to the task force. So there was an $11 million general fund appropriation, some of which was made available to the task force for the work that has already been done, right? So the hiring of subject matter experts, our project management team, those efforts have been funded out of this 11 million. And of the remaining funds, and I don't have an exact amount, but I'm going to guess it's in the 9 million range. That is what we're working with when we talk about this proposed funding allocation. So not asking for any additional money at this point. So for the category of governance, the operation of that governance board for the first 3 years would be about 1.6 million of those remaining funds that have already been allocated. There is a budget or a line item for an initial investment of $30,000 related to the development of dispatch operational standards. And an initial investment of $150,000 related to training and staffing that's continued for 2 additional years. The CAD system that the task force is recommending be pursued would account for a 5-year investment of $2 million. And there's a short-term mapping support line item in our proposal of $40,000, continuing over the 2 additional years to allow those dispatch centers that I mentioned earlier access and licensing for the Rapid SOS solution. And then we've got a line item of $150,000 for the development of that cybersecurity governance, risk, and compliance framework. The biggest chunk of the existing funds, sorry about that, would go toward an initial investment to support the development of an interoperable public safety LMR network. There are others who can speak much more clearly to the details of this, but that initial investment we've got figured in at 4.5 million of those remaining funds. That would include planning and deployment of aspects of an LMR proposal. Let's
LMR
see.
means land mobile radio, by the way.
Yeah, thank you, Dan. Dispatch center facilities, the governance board would be working on the development of benchmarks for those facilities. And then the dispatch equity funding strategy. So dispatch fees, the dispatch fee structure would be a task that the governance board takes on to finalize that. And following the third year, that fee formula likely would go into effect, probably gradually implemented over time. So some of the funding in the remaining funds would go to supporting those dispatch fees for some number of years. And this would also allow us to consider alternative funding options that might have been useful in other jurisdictions that could prove useful here in Vermont. So I haven't totaled up all my math, but it should approach the $9 million mark with all those items in there. And again, this is existing funding that we would simply need the authority to work with. And then, so in summary, really what the task force would like the legislature to consider is authorizing the task force to allocate a percentage of the remaining Act 78 program funding, specifically initially to prepare a computer-aided dispatch RFP, request for proposal. We've already begun work actually on gathering or identifying who might be involved in a stakeholder requirements gathering effort and so on. And then the funding to provide all Vermont dispatch centers with the licensing for this rapid SOS solution that I mentioned earlier. We'd like the legislature to direct the task force to initiate activities to create the proposed Public Safety Governance Board, Communications Governance Board, and allow us the authority, if you will, to continue to work the program until a governance board is established. And a few of the efforts underway are listed or that would be underway are listed here on the slide. And I'll pause once again here to see if Dan or Paul have anything to add at this point.
No, thank you. Gentlemen?
I think perhaps the only other piece that I'll mention is around the equity piece. And just for those who are new to this, there are a number of communities that pay for dispatch, particularly when it comes to the state police dispatch service. There are a number of communities who do not. There's also a number of shared services that different municipalities utilize that are common to everyone or common to most. And most of those are not charged for. So we think it's pretty reasonable to say that we can envision, and by the way, we're not trying to break the budget of any municipality or any of this sort of thing, but to say that there is probably some responsible way to determine what measure of cost goes into those things and divide it equally among the users of it. So that's a piece that's under discussion that would be under discussion with the governance, but the idea is to make things equal within the framework.
Okay.
Paul, anything?
Sure, I guess I'll jump in now.
Yes, please.
Good morning. My name is Paul White, and if you look at your agenda for today for the committee, it would give you the impression that I'm here speaking on behalf of the Vermont State Police, but that I just want to tell you that is in fact not the case. I am retired from the state police, but I am here solely as a representative of this task force. I guess the beauty of my position now on the task force is that unlike Barb and Deputy Commissioner Batesy is that I'm no longer working for the state. So perhaps I can get away with saying things that they can't. I guess when this task force was first assembled, 2.5 years ago, and then the prior working group in 2022 before that, the situation was different than what we find ourselves in today. There was a lot more urgency when the task force and the prior working group were stood up. There was a lot of expectations that things were going to get done promptly. Every time we appeared before a committee, it was like, why aren't you moving faster? This has got to get done. There was really a high sense of urgency. Since this biennium began, I, for one, don't feel that sense of urgency anymore. In fact, I came into this committee meeting today wondering if the committee members are even aware of this task force in our work, or are we just sort of this entity that's chugging away in the background? And it's not just from this lack of feeling the sense of urgency, not just from the legislature, but also from the administration. So for my takeaway from today is I'm hoping to get some reassurance that that we're still doing the work that y'all want us to do. We've got somewhere around 4 years of work invested into this project so far. We're at the point where we can't really do a whole lot more without some authorization to spend money that was already appropriated. And so I guess I would like to walk out knowing that we've given you a little more understanding of what we're doing, and that we have an understanding of what you would like us to do, and that we're not just headed off down a path that nobody wants us to go down anymore.
Yes, thank you very much for that, sir. The reason we have you in today is we know that the report has been preliminary, has been delivered, and we're expecting some more information, I understand. And we're really interested in this subject. Back when we were down in room 10, we had you all in a couple of years ago, and this was really important to us. So this is our follow-up to see how things are progressing, and really happy to hear your recommendations. We will take them seriously and work with you on them. So yeah, we have not forgotten. So thanks for being here.
Okay. Well, thank you.
And,
Thanks for having us tonight.
Just for the record, how would you like to be listed on our agenda? Because we'll relist your title.
I'm the vice chair of the Public Safety Communications Task Force.
Okay, great. We will relist that.
When I previously chaired the working group that preceded this task force, I was the chair of the Barrytown Select Board and was actually representing the League of Cities and Towns, but I can't even say that anymore because I chose not to run for my seat on the select board. So I'm just a task force member at this point. Thank you.
Well, thank you very much for that work. We appreciate it, and we'll get that corrected on our agenda. Any questions for Mr. White or Ms. Neal or Deputy Commissioner? There's a lot here. We're going to have some follow-up meetings for sure. So we have a few more minutes. We have a while yet.
Yeah, no, we do have to, but I mean, if there's nothing else from these folks.
Anything else on the report that you feel is important for us to know now, Ms. Neal?
I think the most important thing right now is maybe that there are more details coming that I think will, kind of help enhance your understanding of what it is the task force is recommending, provide a little bit more context perhaps. Other than that, though, no, I guess the answer is no. I plan to send you a copy of the presentation from today. Is it useful, or do you already have those two other big reports, the system planning and the inventory and assessment? I could send those along as well, if that's helpful.
Have posted on our page. Hold on, let me pull this here.
I'm not sure we have those reports.
The recommendation.
Yeah, we have the recommendations from the task force. Yeah, so if you want to send us both of those clean with the presentation, that would be amazing.
Okay. They're lengthy, just preparing you.
Duly noted.
Okay, so I will send those along as well. And I think I speak for all of us when I say we're looking forward to continuing the conversation, and we'll get the details to you as soon as they become available. And sounds like we'll talk again.
It's great. Thank you. I do have one additional question, and you may have said this while I was briefly out of the room. When do you expect the next report to be filed?
Correct me if I'm wrong, Dan or Paul, but I think we are looking at the next 10 days to 2 weeks to get that over by the end of the month.
Okay, very good.
Is my recollection.
Yes. No, and it's my intention to do work within this deliverable and also some of the other components that revolve around this when we are taking a look at our emergency management and emergency response policy in the coming weeks. So Representative Hango is going to be the point person on this conversation. So thank you for getting this to this point. I know this was a massive lift, a big charge and duty, and we look forward to honing it in with you.
Also,
Great.
thank you on behalf of my colleagues as well. And I do concur, this is a rabbit hole that can take you in all technical and other directions. We are more than happy to answer your questions anytime and follow up with anything that you would like us to follow up on.
That would be great. As clear and concise as possible in layman's language would be much
I
appreciated.
know the right guy for that.
Thank you so much.
All right,
Well,
thank you. Thank you very much.
We once had an acronym chart developed by the National Guard and that organization. No, just a thought.
Okay.
195 pages long.
No, but like, I'm serious.
Thank you so much.
Yes.
Very much.
Thank you.
So, all right, thank you very much. All right, committee, we did finish up a little early, but let's take a look at the stuff we're gonna be working on later today. And we also had a big slug of bills come in the last 48 hours.
Yeah.
So if folks want to start identifying things for action, or I shouldn't say action, but for introduction and walkthrough, start taking a peek at the wall because it is, I'm at the point where I think I might have to ask DGS for another cork board.
Oh, yeah.
And I have a long lunch meeting from 12 to 1. So I'm going to go get on some emails and some other correspondence that I need to attend to.